Hello everyone, Nick NK Active here. So I thought we would just have a quick chat about what is the patient journey when someone's coming to see us at NK Active. So once they book an appointment, before they even step into clinic or click on that join your virtual appointment now button, everyone is sent a pre-assessment questionnaire. We've got a registration form which just takes basic name, address, details, GPs, next of kin. We also ask people if they are willing to consent for anonymised data to be used part of research projects and audit data so we can help improve in our service. But then they are then also sent an electronic 4-page questionnaire that allows us to get a good medical history, but then also allows the patient to explain in their own words what their problem is, what they want to do about it, who they've seen in the past, so we can get as much information as possible. And if that form's filled out correctly, sort of about 70% of the time, we've already got a few working diagnoses rattling around in our heads of what's going on. So if they physically come into clinic, they come into the Peppermill Barn clinic as our main clinic, or we do have a satellite clinic that we sort of run once a fortnight in the morning out of a private hospital in Basingstoke. But the Peppermill Barn in Romsey is the main clinic. They'll come in, they'll be greeted by one of our fabulous admin team, which is Linda or Emma. And then they will be then taken into the consultation by myself, Charlie or David. And through that, we'll then go through that form that they then filled in for us. We'll then start asking, letting them again re-explain what's going on, so then they've got a chance to then elaborate on stuff they put in a form or fill in the gaps of things they may have thought, oh no, I sent that form, I submitted it, I needed to tell Nick or Charlie or David about these things. They get the chance to do that. Then we then follow it up with any questions. I personally just write little bullet point notes as I go just to jog my memory in case I want to ask. I've got a general rule of thumb, I don't like interrupting people. I will just sit there and listen and just make notes, because I think if you interrupt someone, you may interrupt them just before that one golden bit of nugget information and they're about to see that is the keystone to the whole puzzle. As well, I think the way I look at my roles is almost like that detective. The patient in front of me holds all the answers, and that they may be the crime scene and in a police inquiry, for example, and we're the detective. All the information's there. I just got to ask the right questions and set the right scenario to tease that information out to then build that perfect picture, as it were. And once you get that, then that's when you can then start in my head, okay, start thinking about working diagnoses. And then if they're in a face-to-face appointment, we'll then get them to start doing certain clinical tests and examinations to start trying to, if we've got a list of differential diagnoses in my head, start ruling things out by doing different tests to think, oh, okay, this is long the medial ankle, is it FHL, is it tib post, is it FDL? So you start doing different things to try and rule out one or the other. And then once we then got our working diagnosis, we then sit down and explain to the patient what their diagnosis is. And then we then sort of say, okay, what are your now expectations from this? What do you want to achieve from starting this journey from us? Because the times, honestly, when things haven't gone to plan, it's not because the patient's done anything wrong. It's because I haven't managed those expectations well enough from day one. And normally it's because I may have forgot to ask what their expectations are. If someone's coming in with a raging mid-portion Achilles tendinopathy and they say, oh, I want to run a marathon in 2 weeks, you know that's not going to happen. However, unless you do something to address that, you're just setting yourself up for disappointment and not meeting those expectations. We also do a lot of things about trying to change the perception of not talking about pain, to get it more about function, because I think if you're talking about pain a lot of the time, you can sort of not put yourself in the right mindset of ready to keep moving forward and getting better, as it were. So we start talking about goals and we start talking about activities and where they want to be. So they may want to say, actually, I want to be able to walk 10k in 3-4 months time. Then you address, is this realistic? yes or no. So once you then got those goals and those expectations, you then sit down and discuss all the treatment options available for them. And the way we like to explain it here is that we don't fix anyone. The body will do it itself. We just need to help educate the person to help put themselves in the right mindset and the right scenario to achieve those goals. And we will never tell someone, you must do this, this or this. At the end of the day, it's their problem, it's their pathology, they need to own it. And we just need to help guide them along a path, because there's no one perfect treatment that's going to suit every single person at every given time. So we can say these are the options available to you, and then start chatting about where this needs to be. So we may decide actually we need some more information. So we may say, actually, do you know what, we're going to really benefit from doing a 3D gait analysis and some strength testing. We may decide, actually, do you know what, there was just a case of too much too soon, sudden change in activity levels. Well, actually, your gait's not really going to, if you've gone from no level activity to say walking 20k a week, the odds are your gait doesn't really matter. It's that loading. So it's education about load management, and then it's then maybe then going through a targeted rehab program where we teach people to then manage this themselves and teach them how to get stronger and then help reduce the risk of it reoccurring. We may decide that you need to go shockwave. We may decide that we need to look at foot orthoses. We may decide we need further imaging or a referral to the sports medicine team, the rheumatology team, or the orthopedic team. But the thing is the plan is always come up with in agreement with the patient. So, and then after that, we will then dictate or type a letter, which then goes into our notes, but then is sent to the patient, and then if they consent, to their GP and anyone else involved in their care, because we know full well the odds are they're not going to remember everything we said in this consultation. There's going to be a lot of information to take in. So if we then give them a letter, which then tells them a step-by-step plan, they also then know what to expect going forward. And we will also talk through all the treatment options available. So if what we do doesn't solve the problem for them, it doesn't mean no one's failed. It just means that treatment doesn't work for that patient at that time, and they need to move on to the next step. So if they need to move on to that next step, it's not a complete shock to them already. And then once we then go through the whole treatment process, whatever it is, we'll then fill out a last final appointment questionnaire where we can see have we achieved the goals, what are the patient's activity levels back up to. And then at 6 months, 12 months and 18 months after their last appointment, they will then get follow-up questionnaires, which we encourage people to fill in. So then we can then see how people are doing once they've left us at NK Active. And we're pretty lucky in that we can show that actually when people leave us 6, 12 months down the line, they are still doing all their activities, they're still working. A lot of them have over doubled what their activity levels are. So that's sort of your patient journey and what to expect when someone comes to see us at NK Active. See you later.